Chris. Hi, good morning. My name is Joanne. I'm going to be your nurse today. How are you?
I'm okay.
Oh, just okay? You feeling kind of under the weather?
Yeah. I wouldn't be here if I was.
Did you get any sleep last night?
Yeah.
Yeah? Just good sleep? Not so good?
It's all right.
How many hours do you think?
I don't know, 5, 6.
Do you feel well rested?
Okay.
You're just okay? Where's Fred?
Oh, he had to get back to the dogs house.
Oh, you have dogs. How many dogs do you have?
Just 2.
Oh, what kind of dogs are they?
Mutts.
Oh, I have dogs at home too. What we're going to do today is I'm going to ask you a few questions, okay? I understand that, you have some new diagnosis. So I'm just going to ask you a few questions, and then after this I'm going to call Dr. Weiss, and I'm going to have her explain to you a few things, okay? You feeling okay? You kind of slouch over. Are you in pain?
No, not really.
No, just a little. How are you feeling?
I'm okay.
Just okay. All right. So I know some of these questions may sound kind of silly, but I just need to assess your overall self, okay? So can you tell me your name and date of birth?
Hector Enriquez, July 14th, 1988.
All right. And do you know where you're at?
Yeah, I'm Mountain View Hospital.
Okay. And then I'm going to check your blood pressure, and then your pulse, and then your temperature, okay? You're at 140/82. It's a little bit on the high side, but not too bad. Check your temperature. You're at 99.8, and then your O2 98, and then heart rate is at 63. So I understand you were kind of having a fever on and off. Right now your temperature's a little bit high, but not feverish yet. So we're going to check to see if we can give you some Tylenol, okay, or whatever you're prescribed for your temperature. Let me see here. Okay, now I'm going to do a complete body assessment. I'm going to assess your eyes, your nose, your throat, your lung sounds, heart sounds, all that good stuff, okay? So first, I'm going to have you follow my finger with your eyes. Go ahead and remove your glasses for me. And don't move your head. Okay. And I'm going to have you focus over there. I'm going to take a look at your eyes. I'm going to shine a light, okay? I'm going to look under your eyes. Perfect. Ready? I'm going to look inside your ears. Are you having any ear pain lately?
No, not really.
The other side. Look at your nose. Change this. Tilt your head up just a tad bit. Inside your nose. Thank you. Clean this off. I'm gonna look inside your mouth, okay? You're gonna stick your tongue out and say, ah. Go ahead and stick your tongue to the roof of your mouth. Thank you. All right. Now I'm gonna feel for lymph nodes, okay? Touch your face. Feel under your chin and your neck. You see you got some lumps there, lymph nodes are a little bit swollen. All right. And then I'm going to listen to your heart sounds. And just relax, okay? Breathe normally. All right. I'm going to listen to your lung sounds. And have you take a deep breath in and out. In and out. In and out. All right. I'm also going to check your abdomen, okay? I'm going to feel for any lumps or if you're feeling any pain there, okay? I'm going to have you put your feet up right here, the other side. Other side. You're going to lay flat. Lay flat for me. Both feet up. There you go. Now I'm gonna press on your abdomen, okay? And you relax your hands right here. Let me know if you feel any pain, any tenderness, just a little or too much.
Just a little.
Okay, deep breath in and out. Deep breath in and out. Okay, perfect. All right, go ahead, have a seat. I'm gonna have you squeeze my fingers. Squeeze, squeeze, squeeze. Good. Good strength. Okay, I'm gonna have you push down like a gas pedal, okay? Push, push, push. All right. And I'm gonna have you fight back, okay? I'm gonna pull your hands right here. Good strength. Thank you. I'm gonna listen to your abdomen for some bowel sounds, okay? When was the last time you had a bowel movement?
Yesterday.
Yesterday. Right. What was it? Was it normal? A little bit having diarrhea, constipation?
Yeah, it's pretty normal.
Pretty normal. Okay. Now I'm going to have you roll your sleeves up past your elbows right here. Look at your skin and then turn over like this. Beautiful. I'm going to check for pulses. Check your pulses on your feet. All right. Thank you. Now, the next questions I'm going to ask you, a little bit about how you're feeling, okay? And I want you to answer openly and honestly, okay?
Sure.
As best as you can. Okay. Are you feeling depressed?
Yeah.
Yes. Can you kind of explain it to me a little bit?
I don't know. Life, it's just, I don't know what sicknesses and just kind of everything.
Are you feeling suicidal at all?
No, I'm not suicidal. Just down.
Now, do you feel like you have some energy to do things or to try out new things?
Not really.
Okay. Has your partner been supportive at all?
Yeah, I think he's probably been the only one that's been supportive.
Okay. How about your family?
Not really.
Not getting very supportive from your family. Okay. How about do you have any religious affiliations?
Yeah. I'm Christian. Like, I don't know, once or twice a month.
Okay, you go to church. How do you feel when you go to church?
It's kind of tough, just because it's like everyone looks at you different.
Okay.
Because
So just the people, right? But
yeah.
okay.
Pastor, I guess too.
Yeah. Now, I'm going to ask you also about family history. Now, do you have any family history of any heart conditions?
Yeah. Families. I don't know, like Grandpa had some heart something or other. Ended up dying.
How about your dad?
Yeah. He has to kind of watch what he's doing.
Okay. Are you a smoker?
No.
And then what's your diet like?
A lot of carne asada fries.
Do you like the hospital food at all? I bet you that's a change, huh?
It's a little different.
Yeah. Okay, so let's see here. Now I feel like I have all the information that I could get. Let me just double check here. Right. Okay, so I'm going to hand this over to Dr. Weiss, and she's going to come in and talk to you and kind of explain to you a few things, okay?
Cool.
I'll be right back. Knock, knock. Hi, Hector. Hi, I'm Dr. Weiss. How are you? Good. How you feeling today?
Okay.
Just okay? I haven't seen you yet, so I kind of wanted to get to know you a little bit, okay? Nurse Joanne just told me a little bit about you and kind of the questions that she asked. So I'm gonna, if you'd like, I kind of want to discuss them with you. Will that be okay?
Yeah, sure. That'd be fine.
Okay. All right. All right. Let me here. Okay. So it looks like your vital signs are good. You know, your blood pressure is just a little bit high. She kind of explained to me your diet. Lots of greasy, fatty foods, and family history as well. So now I understand that you know it might be hard for you, especially with this new diagnosis that you have. Okay, I want you to understand that there is a lot of lifestyle changes to be made. Okay, I know it's hard, but we're gonna get there. We're gonna try to help you out as best as we can. Okay, so for one, diet. Okay, I understand that you said right here that you lost about 5 pounds in the last 2 weeks, but it's kind of unexplained because you still eat, you know, okay. Kind of had a loss of appetite a little bit.
Yeah, a little bit, I guess.
Yeah.
I don't know. Yeah.
Yeah, but just kind of unexplained weight loss. So that is definitely a symptom of having HIV. I know that you don't get a lot of support from your family. It looks like, you know, only your partner's been very supportive. I want you to understand that, you know, we're also here and we want to give you all the help we can give you. I would recommend that you attend some support groups and bring your partner along as well. Okay. With support groups, I want you to be able to kind of socialize a little bit, you know, kind of understand the disease process a bit more, especially coming from people who actually have them as well. Okay. I'm going to go over this real quick. Now, I noticed the lumps, you know, in your neck area, and you also have that in your groin area as well. That's from the Hodgkin lymphoma. You know, your lymph nodes are going to be swollen. Okay, you're going to feel a little bit of tenderness there, but you know, I want to explain to you that there are some treatment options for that. That includes radiation and chemotherapy, which we will discuss with you further. Okay, we're going to do some more testing. We're going to get your blood work done. We're going to make sure that we kind of keep track of you. Okay, because like I said, we want you to come out of this successful, and we're here for you. Okay. Nothing in the eyes, ears, nose, throat. You're not having any pain, just loss of appetite. So, you know, with having HIV, the GI tract can, you know, can be also damaged, and so you will experience some diarrhea at some point, and that's okay. You know, with the treatment that we're gonna start you on, hopefully that can alleviate some of the symptoms. Okay. Also, there is this thing about exercise. I know you go on walks with your partner and with the dogs, but muscle wasting is a symptom of HIV, and we want you to be able to kind of keep up with your exercise routine. Okay. Also, watch out for signs and symptoms of urinary tract infection. Okay. Make sure that you're emptying your bladder completely. If you feel like you're not, you know, that can be a little bit concerning because you're more prone to developing urinary tract infection. Also, you know, you kind of notice that you're a little bit depressed. We'll make sure to get you some medication for that. It's nothing to be ashamed of. It's okay. People experience that, and we want you to be able to be successful. So we're going to start you on some medication for that as well. And then heart disease. You know, you're more predisposed to developing heart conditions because of HIV. So we want to be on top of that. You know, we want you to change your diet. We're going to put you on a heart healthy diet. So lessen the grease, lessen the fat, lots of fruit and vegetables. Okay. And then respiratory, anytime you have a cough or you feel you have a cough coming on, you know, let us know. Because like I said, we want to stay on top of it. You're more predisposed to having respiratory infections, so we want to keep track of that as well. And then social support. You know, your partner's been very supportive. I want you to keep up with that. You know, keep up with your relationship. Walk your dogs as often as you can, and you know, I also want you to be able to start having friends. You know, like kind of like, especially with that support group that I told you about. I want you to get to know some of these amazing people as well. Okay. There's another issue about well, it's not really an issue. Another thing about having pets. You know, I don't know if they are trained to defecate outside, and but you have to be careful because you are more prone to getting infections, and their feces can contain some bacteria that doesn't pose any harm to people who don't have HIV, but it can pose harm to you. So make sure to wash your hands before and after, and before and after you prepare your food. Okay, so watch out for that. Lots of hand washing. Okay. And I want to set some goals for you. Okay. And these are goals that I feel like you'll be able to attain, especially with the help of your partner. Okay, I want you to develop more trust. I would suggest, you know, if you could, to kind of talk to your family about it. Maybe you'll get some support. But if you feel like you don't, you know, don't feel like you have to, but at least be able to tell someone about it. I can also recommend you to a psychiatrist so that you'll be able to talk to them once a week. Okay. I want you to set some goals right here about attending support groups with your partner every week, and I want you to report your level of depression after every session. Okay. You're gonna write that in a journal, and then when we see you again, we're gonna talk about it. Okay. And then I also want you to be able to set a goal spiritually, because it seems like you enjoy attending church until you feel that people at church are kind of judging you. I want you to kind of regain their trust. If you'd like, you know, host a Bible study at your house every couple weeks to start out, and then maybe kind of increase it to every week. But that way, you know, you can continue with the socialization aspect and also improve your spiritual strength, because it looks like you're pretty religious. So I want you to be able to kind of continue that. Okay. And then the last thing is I want you to try a new hobby. Can you do that for me? Try a new hobby you've never done before. Do it with your partner. Do it by yourself. But I want you to start a new hobby like knitting, painting, or learning a new sport. And then do that once a week. And then I want you to write it down in a journal. Next time we see you, I want you to kind of explain to me what you're doing, anything new that you're doing, okay? And then that way you can develop your talents, and then also avoid a sedentary lifestyle. Because like I said, remember that muscle wasting. I want you to be able to keep at it, okay? All right. Do you have any questions for me?
No.
No. Okay. Like I said, we're here for you. We want you to come out of this successful, okay? If you need more explanation, more materials to read, we're here for you. You can ask the nurse, you can ask for me, and then we'll be able to explain some things to you, okay? And it doesn't matter how many times we explain it to you, but we want you to be able to understand it, okay? All right. Well, it was nice meeting you.
Nice meeting you.
All right. Thank you so much.